laptop tagiri. Good morning all. Today's class will see about broad spectrum antibiotics. The name itself indicates broad spectrum means they act against wide spectrum of antimicrobials. So under this there are two drugs, tetracyclines and chloramphenicol. So tetracyclines and chloramphenicol are the broad spectrum antibiotics. They are being very active and effective against wide range of microorganisms. That is why they are called as broad spectrum antibiotics. So they have got 4 cyclic rings in their basic nucleus. That's why they are called as tetracyclines. Tetra means 4. So first we'll see about tetracyclines. They all are obtained from soil actinomycetes. Chlor-tetracycline is the first member of this group. It is introduced in 1948 and then followed by oxytetracycline in 1950s and tetracycline in 1953. Then coming to the classification, they are mainly classified into 3 groups: short acting, intermediate acting and long acting. Short acting, they act about 6 to 10 hours. They are tetracycline, chlor-tetracycline, oxytetracycline. Whereas intermediate acting drugs, they act about 12 to 13 hours. Demeclocycline, methacycline. And long acting, see about 18 to 20 hours. Doxycycline and minocycline. Again, they are classified into naturally obtained, that is from soil, so streptomyces, and semisynthetic one. So natural one, chlor-tetracycline, oxytetracycline and demeclocycline, and semisynthetic are tetracycline, doxycycline and minocycline. So we'll see the common properties of these tetracyclines. As I told earlier, they have got 4 hydrocarbon rings in their nucleus. They are bitter in taste. They are bitter, solids and weakly water soluble, but their hydrochlorides are more soluble. Aqueous solutions are unstable. Aqueous solutions are unstable. Some antimicrobial activity only they have got similar antimicrobial activity, but they have got minor differences among the drugs. Newer ones have got high lipid solubility and greater potency. Next, we'll see mechanism of action of tetracyclines. They are primarily bacteriostatic in nature. How these drugs enters the bacteria? In gram-negative bacteria, they enters by active transport, whereas in gram-negative, they act through porine channels. What is the exact mechanism of action? These drugs goes and binds with bacterial 30S ribosome and inhibit bacterial protein synthesis. So they binds to bacterial 30S ribosome and inhibit bacterial protein synthesis. And they prevent the attachment of amino acyl tRNA to acceptor site, that is A site. There are 2 sites, acceptor site is called as A site and peptidyl site. Okay, so they prevent attachment of amino acyl tRNA to the acceptor site on mRNA ribosome complex. As a result, the peptide chain fails to grow. So, Lakshmi, so this picture depicts you where the tetracycline goes and binds and prevents attachment of amino acyl tRNA to the 30S ribosome. Then we'll see the spectrum of activity, antimicrobial spectrum. As I told earlier, they are bacteriostatic drugs. They are active against all type of organisms except viruses and fungi, both gram-positive, gram-negative bacteria, Rickettsia, Chlamydia, Mycoplasma, Actinomycetes, and some of the protozoa. Okay. So, cocci, all positive and negative cocci originally sensitive to tetracyclines. Now, step RS, step pyogens and enterococci, they respond to this drug, and response to pneumococci is reduced. Nowadays, tetracyclines active against few N gonorrhea and N meningitis. Then positive bacilli, Clostridiae, Listridiae, B. anthracis, etc., but not for mycobacteria. Then gram-negative bacilli, cholera, Yersinia, Pesti, Brucella, etc., but H. influenza become insensitive. Whereas Enterobacteriaceae are resistant and they are not effective for tetracyclines. Then spirochelates are quite sensitive, whereas all Rickettsia, Chlamydia are highly sensitive to tetracyclines, and Mycoplasma and Actinomycetes, they are moderately sensitive, whereas protozoa, that is Entamoeba histolytica and Plasmodia, inhibited at higher concentration of tetracyclines. Then we'll see how the organism develops resistance against tetracycline. The development of resistance is slow in graded manner. So the first mechanism is tetracycline concentrating mechanism is less efficient in those bacteria. Or even if the drug enters the bacteria, they'll develop a capacity to pump the drug out. That is called as efflux of the drug. Or they also synthesize protection proteins. The bacteria will synthesize protection proteins. These protection proteins protect the ribosomal 30S ribosome where the tetracycline goes and binds. Where the tetracycline goes and binds. That will be protected by protection protein which is synthesized by the bacteria. And tetracyclines, they develop an inactivating enzyme. The bacteria will develop tetracycline inactivating enzymes. Those enzymes inactivate tetracyclines. And some of the organisms, they develop cross resistance with the other tetracyclines. Then we'll see the pharmacokinetic properties. The older drugs are less absorbed, about 60 to 80%, because food interferes with their absorption. Whereas doxycycline and minocycline, they are completely absorbed. So one more important property of tetracyclines are they have got chelating property with calcium and other metals. So regarding this chelating property, we'll discuss during adverse events. And milk antacids and iron preparation reduces absorption of tetracyclines. So while administering these tetracyclines with milk antacids and iron preparation, you should keep a gap of 2 hours. And distribution, they are wide distributed and they have got variable protein binding. Different members have got different protein binding capacity, and they are concentrated in the liver, spleen and bone, teeth. Minocycline is highly lipid soluble and accumulates in the body fat. Santosh. ಇಷ್ಟು ಹೊತ್ತು ಹೋಗಿರಲಿಲ್ಲ. ಓಕೆ, ಯಾರೋ ಒಬ್ರು ಇಲ್ಲೇ ಇರಿ, ಪಕ್ಕನೇ ಇರ್ತೀವಿ. ಓಕೆ. So it has got good CSF penetration, 1/4 of the plasma concentration, about 1/4 of the plasma concentration. So it is intracellularly binds to mitochondria. It is primarily excreted in urine. In renal diseased patient or renal failure, you have to do the dose adjustments. So doxycycline is also excreted in bile, and some amount is undergo enterohepatic circulation. So tetracyclines also secreted in the milk, which may affect the suckling infant. So they are contraindicated in lactating mothers. So phenobarbital, phenytoin, these drugs increases metabolism of tetracyclines. So what will happen? The T half of tetracycline decreases. T half of tetracycline reduces. Then coming to the administration, it is available in the form of oral capsules. They are taken half an hour before or 2 hours after the food. Why? Because food interferes with their absorption. To avoid this, you have to take half an hour before or 2 hours after the food. So should not be given by intramuscular injection. It's very painful. But oxytetracycline and tetracycline are available for slow IV infusion. They are also available in the form of creams, ointment, and ocular topical application preparations. So creams and ointment should not be used because of their high risk of sensitization reactions. But ocular application is not contraindicated, can be used. Then we'll see the preparations. Oral route is most commonly used route. IM is not recommended. As I told, it's very painful. Oxytetracycline, 250 to 500 capsules or 50 mg per ml vial. And tetracycline, demaclocycline is available 130 to 300 milligram capsules. Doxycycline 100 milligram capsules, and minocycline 150 or 100 milligram capsules. Then we'll see about adverse effects of tetracyclines. They produces irritative effects like epigastric pain, nausea, vomiting, diarrhea, esophageal ulcers. This is important, esophageal ulcer. This is due to release of drug from the capsules while swallowing the drug. If the drug is released into the esophageal region, it induces esophageal ulcers. And other adverse effects like thrombophlebitis of injured vein and organ toxicities we'll see. In the liver, it induces fatty infiltration, may lead to jaundice. And in pregnancy, if you give tetracycline, it can precipitate fatal acute hepatic necrosis. And coming to the kidney, this may lead to kidney damage. Tetracyclines accumulate except doxycycline and enhances existing kidney diseases, may lead to renal failure. Renal failure. Am I audible? One of you tell me. Am I audible? Am I audible?
Excuse me, ma'am. You're audible, but we can't see the slides.
Okay, okay. Thank you. Thank you. I'll see. It's a net problem. I'll repeat adverse effects again. Now, can you see the slides? One of you respond, please.
No, ma'am.
Huh? No?
No, ma'am, we couldn't see.
Yeah, only this adverse effect slide or the previous slide also?
Even the previous slide.
Previous slide also, you are not able to. These preparations, excuse me.
Ma'am, we can't see any slide.
From the beginning,
No, ma'am, we could see still fifth or sixth slide after that.
which one?
Seventh and eighth, ma'am.
So, one of you have told, no, in between. Now, can you see this slide? Hello?
Yes, ma'am. Yes, ma'am, we can
Tetracycline
see.
common property. Yeah, I discussed, no? What
Yes, ma'am,
about
this
this
one we could
slide?
see. We could
Mechanism
see,
of
ma'am.
action? Yeah. What about this slide? Hello?
Yes, ma'am. Mechanism of action we could see, ma'am.
This one, the previous slide, this picture.
Yes, ma'am.
Then antimicrobial spectrum that you can read in the textbook also. I told no, it was audible. My voice are audible, no? Development of resistance. Have you seen these slides? Excuse me? Am I audible?
Yes, ma'am. Yes, ma'am, you're audible. We could see.
This resistance, development of resistance.
Yes, ma'am.
Then we'll go to adverse effects. Okay. This slide. Okay. I start with the adverse effects. Irritative effects like epigastric pain, nausea, vomiting, diarrhea, esophageal ulcers, that is because of release of materials from the capsules while swallowing the capsules, and thrombophlebitis of injected vein. Then coming to the organ toxicities, liver, it may lead to fatty infiltration, may lead to jaundice, and in pregnancy, if you give tetracyclines, it can precipitate fatal acute hepatic necrosis. And in kidneys, the tetracyclines accumulates except doxycycline and enhances existing kidney diseases or renal failure. It may lead to renal failure. Then Next important thing is reversible Fanconi syndrome. It may induces reversible Fanconi syndrome with the outdated drugs, outdated tetracyclines. So should not use outdated tetracyclines. The degraded product of tetracyclines like epitetracycline, anhydrotetracyclines and anhydroepitetracyclines, they damages proximal tubules. Then next adverse effect is phototoxicity. Sunburn-like reactions, skin rashes, mainly after topical application. If the patient is exposed to sunlight, it induces phototoxicity. Erythema, brown-black discoloration of the nail and loosening, etc. Doxycycline and demeclocycline, they produces more of phototoxicity. And teeth and bones. Lakshmi, see,
internet problem.
no problem. ನೀವು ಕೂತ್ಕೊಳ್ಳಿ ಆಯ್ತಾ. Teeth, ಸ್ವಲ್ಪ ಡಿಸ್ಟೆನ್ಸ್ ಮೇಂಟೈನ್. Teeth and bones. Tetracycline have got chelating property as I told in the beginning. The calcium deposited on the bone and teeth, they chelate with this calcium deposited on bone and teeth. In pregnancy, if you give tetracycline, if it affects deciduous teeth in the fetus. And brown means children after birth. So brownish discoloration, ill-formed teeth and are more prone to caries. Tetracyclines, if given between 3 to 6 years of age, it affects crown of permanent anterior dentition. And tetracyclines are given in pregnancy and childhood. It induces temporary suppression of the bone growth. This is the picture indicates brownish discoloration of the teeth. Next, anabolic effects. It reduces protein synthesis, negative nitrogen balance, blood urea may increases. In diabetes insipidus, it antagonizes ADH action and reduces urine concentrating ability of the kidneys. Coming to the vestibular toxicities, minocycline may produces ataxia, vertigo, nystagmus, which is reversible. Then coming to the hypersensitivity reactions, skin rashes, urticaria, glossitis, pruritus, and it may induce a superinfection. Superinfection is removal of intestinal flora. So mouth, skin, vagina may be involved. So Candida albicans are more common invading organisms. It may lead to candidiasis, oral candidiasis and vaginal candidiasis. It may lead to soreness and redness of the mouth, black hairy tongue, and inflammatory lesions in the vulva and vagina. So Pseudomonas enterocolitis, rare but serious adverse effect. So if you give higher doses for longer time, it induces more complete suppression of intestinal flora and greater chances of development of superinfections. Next, what precautions we have to take to avoid these adverse effects? Tetracycline should not be used during pregnancy, lactation and in children. And tetracyclines avoided in patient on diuretics. It may lead to increase in blood urea level. And used consciously in renal and hepatic disease patients, or never use tetracyclines beyond their expiry date. They may lead to Fanconi syndrome. And do not mix tetracycline with penicillins in the same syringe. It will lead to inactivation of the drugs. And do not inject tetracycline intramuscularly, intrathecally. Coming to the uses, first use is empirical therapy. Nowadays it is not used. Maybe initial treatment of mixed infection, you can use tetracycline. And tetracyclines are used as a first choice of drug in venereal diseases, chlamydial, urethritis, endocervicitis. Doxycycline 100 mg is given for 7 days. And next use is in granuloma inguinale, it's given for 3 weeks. And atypical pneumonia, again due to mycoplasma pneumoniae, it's given for 2 weeks. And cholera, it reduces stool volume, it's have got adjuvant values. And brucellosis, doxycycline 200 mg, rifampicin 600 mg per day, 6 weeks will be given. Plague, so tetracycline have got high effective in bubonic and pneumonic plague. Others are rickettsial infection and Rocky Mountains spotted fever, all forms of typhus and Q fever. And relapsing fever also, you can use tetracyclines. So other uses, so these drugs are used as a second choice of drug. 2 penicillins for tetanus, anthrax, actinomyces and listerias. If the patient is allergic to penicillin, you can give tetracyclines. And 2 ceftriaxone, amoxicillin, azithromycin for gonorrhea, and 2 penicillins for syphilis. If the patient is allergic to penicillin, you can give tetracycline. And 2 penicillins for leptospirosis, doxycycline is given for 7 days. And 2 azithromycin for chlamydial pneumonia, and 2 ceftriaxone and azithromycin for chancroid, and 2 streptomycin for tularemia. So tetracyclines are used as second choice of drugs in to the following drugs for following conditions. So coming to the other uses, used in urinary tract infection. If the organism is sensitive only to this drug, then you can use tetracyclines. And chloroquine resistant falciparum malaria, it is used as adjuvant to quinine or artesunate. And also for amoebiasis with the other anti-amoebic drugs, and community acquired pneumonia, acne vulgaris. Then tegacycline is a minocycline analog. It binds to 30S ribosome subunit, and spectrum of activity MRSA, VRE, multi-drug resistance stains, staph pneumoniae, etc. Poor oral absorption, given slow IV infusion, wide distribution, and eliminated through the bile. Used in community acquired pneumonia and complicated skin infection, intra-abdominal infections. It is available in the form of 100 mg loading dose followed by 50 mg 12 hourly by IV infusion. And nausea, vomiting, epigastric pain, diarrhea are the adverse effects. It is contraindicated during pregnancy and in children. Next, we'll see about chloramphenicol. As I told, broad spectrum antibiotics, tetracycline and chloramphenicol. We'll see about chloramphenicol. It's a natural product obtained from Streptomyces venezuelae. It is discovered in 1947. It contains nitrobenzene moiety, which produces its antibacterial activity. So now synthetic products are available commercially. So it is a yellowish white crystalline solid. It is bitter in taste. It is stable in aqueous solution, but stand sunlight. So you should keep protect this drug from sunlight, or otherwise it will stand boiling. Nitrobenzene, it's a antibacterial. Nitrobenzene moiety produces antibacterial activity. This is the structure of chloramphenicol. Coming to the mechanism of action, this drug binds to 50S ribosomal subunit near A site, whereas tetracycline they binds to 30S ribosomal subunit at the acceptor site. This also binds, this will binds to 50S ribosomal subunit near A site and prevents peptide bond formation between the newly attached amino acid and the nascent already formed peptide chain and blocks protein synthesis. So it prevents bond formation between the newly attached amino acid with the already formed peptide chain. Or in other words, it prevents transfer of elongated peptide chain to the newly attached amino acid tRNA at the ribosome mRNA complex. At higher doses, it can inhibit mammalian mitochondrial protein synthesis as well. The bone marrow cells are more susceptible. So, antibacterial spectrum. It is bacteriostatic actually. At higher concentration, it produces sedal effects in some of the bacteria. It is the spectrum of activities like tetracycline, gram-positive, negative, Rickettsia and Mycoplasma. It's highly sensitive to Salmonella, H. influenza, Bacillus fragilis, and less active against gram-positive cocci, spirochelates, and it is ineffective to mycobacteria, pseudomonas, proteus, viruses, and fungi. Coming to the development of resistance towards drugs, there's high incidence of resistance due to indiscriminate use in the past developing countries like India. Resistant strains of STP develops due to transfer of R factor or resistance among gram-negative bacteria by R plasmid encoded for acetyl transferase acquisition, which inactivate the chloramphenicol. So acetyl chloramphenicol will not goes and binds with the ribosomes. Other mechanism, so plasmid also carries resistance to ampicillin and tetracycline, etc. It induces multi-drug resistance, and other mechanism by which the organism develop resistance is decreased permeability into the bacterial cell and decreased affinity of ribosomes towards chloramphenicol. Coming to pharmacokinetic properties, it's given orally or parenterally. It have got wider distribution, 50 to 60% plasma protein bind. It freely penetrates serous cavities and blood-brain barrier. It also crosses placenta, secreted in milk and bile. In liver, it's conjugated with glucuronic conjugated, and in serotics and neonates have low conjugating ability. Little is excreted unchanged in the urine. T-half is 3 to 5 hours. It is available in the form of capsules 250 to 500 mg. Then remember this, the maximum dose 28 gram is given in entire course. The maximum duration of treatment is given should be less than 2 weeks. And it's also available in the form of eye drops, 4% eye drops and ear drops. Coming to the adverse effects, bone marrow depression, very important, bone marrow depression. Of all drugs, these drug causes aplastic anemia, agranulocytosis, thrombocytopenia. It's of two types, non-dose related or idiosyncratic. It's genetic basis and it is unpredictable. It's more common on repeated use of chloramphenicol and higher chances of mortality, and many victims, even if they survive, they may develop later on leukemia. If the victims survive, later they will develop leukemias. And second type is dose and duration related. It's a myelosuppression. This is due to inhibition of mitochondrial enzyme synthesis. It is predictable and reversible. Next adverse effect is hypersensitivity effects, rashes, fever, glossitis, angioedema, nausea, vomiting, diarrhea, pain on injection site. Then coming to superinfection, similar to that of tetracycline, is less common with the chloramphenicol. Next is grey baby syndrome, another important adverse effects associated with the chloramphenicol, grey baby syndrome. So, if you administer high dose of chloramphenicol, within 24 hours, baby starts vomiting, stops eating, rapid and irregular respiration, abdominal distension, baby develops cyanosis, and pooping of loose green stool. Then baby turns ashen gray and becomes flaccid and hypothermic. In many cases, it will lead to cardiovascular collapse and death. So that is called as grey baby syndrome. Higher doses given, baby starts vomiting, stops feeding, rapid and irregular respiration, abdominal distension, cyanosis, and pooping of loose green stools. Baby turns ashen grey and becomes flaccid, hypothermic, and maybe cardiovascular collapse and death. So now, newborns, they are not able to metabolize the drug and excrete chloramphenicol. That is why it is contraindicated in neonates. Then coming to the uses of chloramphenicol. So, for systemic use, the use of chloramphenicol is highly restricted due to fear of fatal toxicities. Before administering the chloramphenicol, you should take these precautions. Never use chloramphenicol for minor infection. Okay, and do not use if the infection can be treated with the other safer antimicrobial agents. Don't use for simple infections. Then avoid repeated course of administration to avoid the adverse effects. And it should not use more than 2 to 3 grams per day. Remember these adverse effects. Precautions: should not use this drug more than 2 to 3 grams per day and use for less than 2 weeks. The total duration of treatment should be less than 2 weeks, and entire course should not exceed 28 grams of chloramphenicol. The entire course you can give at the maximum of 28 grams, not more than that. And regular blood count should be done to see bone marrow toxicity, and should not be combined with the other antimicrobial agents. These are the precautions taken before administering chloramphenicol. Then coming to the uses, enteric fever. In 1980s, this chloramphenicol was the first line of drug for typhoid fever. Nowadays, we are using ciprofloxacin. Next is pyogenic meningitis. It is used as a second line to third generation cephalosporins, and also can be used in children and the patient is allergic to cephalosporins. In those patients, we can use chloramphenicol. And also meningococcal meningitis and H influenza, it's used as second line drug. Next is anaerobic infection and intraocular infections. It's highly concentrated in aqueous solution. So endophthalmitis can be used, and it is used as a second choice of drug to tetracyclines for brucellosis and rickettsial infections in children and in pregnancy if the patient is contraindicated to tetracyclines. Also used in it's used as alternate to erythromycin for whooping cough. Next use is urinary tract infection. Should be used only when the kidney substance is involved and the organisms are sensitive only to chloramphenicol. topically in conjunctivitis, external ear infections, not to be used on skin or other areas. So these are the questions. Please take down these questions. Write the mechanism of action of tetracyclines. Second question, write the adverse effects of tetracyclines. Then precautions and uses of tetracyclines. Then adverse effects of chloramphenicol and precautions and indications of chloramphenicol. Please write answer for these questions and you can mail it to pharmacology departmental mail. Okay. If you have any doubt, you can write in the chat or you can mail it to pharmacology departmental mail. Thank you. Anybody wants to ask any questions? Anybody? You can unmute and you can talk to me. ಇಲ್ಲಿ ಬರುತ್ತೆ chat box or attendance chat ಇದೆಯಾ? ಎಷ್ಟಿದೆ? 217. ಇದು ಡೌನ್ಲೋಡ್ ಮಾಡ್ಕೊಳ್ಳಿ ನೀವು. ಇಲ್ಲ ಅಷ್ಟೇನಾ? ಕೇಳ್ಬೇಕು, ನಾನು ಕೇಳ್ತಾ ಇದ್ದೀನಲ್ಲ ಈಗ ಚಾಟ್ ಅಲ್ಲಿ ಇಲ್ಲಿದೆಯಾ? If you want to see any slides, can you let me know? Recording stop ಮಾಡಬಹುದಲ್ಲ? ರೆಕಾರ್ಡ್ ಸ್ಟಾಪ್ ಮಾಡಿ ನಾನು ಸ್ಟಾಪ್ ರೆಕಾರ್ಡಿಂಗ್ ಏನು ಮಾತಾಡ್ಬೋದಲ್ಲ ನಾನು? ಓಕೆ ಓಕೆ